The skill of intermittent or straight catheterization is a bit different for female and male patients, but you'll prepare for the procedure the same way. Begin by checking the provider's order. Remember to also check if the patient has allergies to betadine or latex. Perform hand hygiene and provide privacy. Introduce yourself to the patient and identify her using 2 identifiers.
Hi, I'm Jenny. I'm going to be your nurse today. How are you doing?
Okay.
Good. Can I ask you to state your name, please?
Mary Thompson,
All right, and your birthday.
January 1st, 1950.
Okay.
Explain that you're going to insert a catheter to drain her bladder.
I'm going to go confirm the orders for your straight catheterization and gather my supplies, and I'll be right back, all right?
Thank you.
You're welcome.
Then collect the equipment and supplies you'll need for the procedure. Raise the bed to a comfortable working height. Ensure that there is a waterproof pad under her. Now you're ready to position her. Help her into the dorsal recumbent position, lying on her back with her knees flexed. Ask her to relax her thighs. Drape her by placing a bath blanket over her in a diamond fashion, with the corners at her midsection, thigh, abdomen, and perineum. An alternative position for a female patient is the side-lying or Sims position, with the upper leg flexed at the knee and the hip. To avoid contamination, drape the anal area. Use pillows for support if necessary. Apply gloves and wash the patient's perineum with soap and water. Then rinse and dry the area. See the video skill performing perineal care for a female patient. Before you remove your gloves, examine the patient and identify the urinary meatus. If you can't see well enough, adjust the lighting or ask an assistant to hold a light. Then discard your gloves and perform hand hygiene. Open the catheterization kit. All the supplies you need are inside the sterile tray, which can also be used for urine collection. Prepare to drape the patient's perineum. Pick up the square drape and let it unfold. Place the drape shiny side down, on the bed between the patient's thighs. Ask the patient to lift her hips and slide it just under her buttocks. To maintain the sterile field, take care to only touch the 1-inch edge of the drape while placing it. Put on sterile gloves. If your kit contains a fenestrated drape, let it unfold without letting it touch any unsterile surface. Allow the top edge of the drape to form a cuff over your hands and cover the patient's perineum with the drape, leaving her labia exposed. Arrange your supplies on the sterile field, maintaining the sterility of your gloves as you work. The sterile tray contains the catheter, a lubricant, and a cleaning medium, such as pre-moistened swabs or cotton balls, forceps, and solution. Open the packet of lubricant and lubricate the catheter by dipping it into the water-soluble gel to the correct depth. Pour sterile antiseptic solution over the sterile cotton balls. If the kit you're using contains a package of pre-moistened swabs, open the end of the package so you'll have easy access to them. Now you're going to cleanse the patient's urethral meatus. Separate the labia with the fingers of your non-dominant hand. Remember, this hand is now contaminated, and if the labia close, the area surrounding the catheter will be contaminated, and the earlier steps of the procedure must be repeated. Pick up the forceps, holding 1 cotton ball at a time. Use a new cotton ball for each area, working from the clitoris toward the anus. Begin with the far labial folds. Then move to the near labial folds, and then work directly over the center of the urethral meatus. Pick up the catheter 7.5 to 10 centimeters, that's 3 or 4 inches, from the tip. An assistant may shine a light for you to better visualize anatomic landmarks. Make sure the urine tray is positioned so that the urine will drain into it. Advance the catheter a total of 5 to 7.5 centimeters, or 2 to 3 inches, or until urine flows out of the catheter. Release the labia, but hold the catheter securely with your non-dominant hand. If a specimen has been ordered, collect it by holding the end of the catheter in your dominant hand and letting 20 to 30 milliliters drain into the specimen container. Allow the bladder to empty fully into the collection tray or up to the amount allowed by your agency's policy. When the urine stops draining, withdraw the catheter slowly and smoothly until it has been withdrawn completely. A male patient should be placed in the supine position with his legs extended and his thighs slightly abducted. Drape the patient by covering his upper body with a small sheet or towel so that the perineum is exposed. Then perform perineal care. For a refresher, see the video skill performing perineal care for a male patient. Open the sterile straight catheterization kit. Pick up the square drape and let it unfold without touching any unsterile surface. Place this drape over your patient's thighs, shiny side down, just below the penis. Then put on sterile gloves. With the sterile tray and its prepared contents on the sterile drape, lubricate the catheter tip to the required depth. With your non-dominant hand, retract the foreskin if the patient is uncircumcised. Gently grasp the shaft of the penis just below the glands and hold the penis at a right angle to the patient's body. Using your dominant hand, cleanse the urinary meatus with cotton balls or swabs, using circular strokes, beginning at the meatus and working outward in a spiral pattern. Repeat this process 3 times using a clean cotton ball or swab each time. Gently apply upward traction to the penis and slowly insert the catheter through the urethral meatus. In a male patient, you'll advance the catheter 17 to 22.5 centimeters, or 7 to 9 inches, or until urine flows into the container. If you feel resistance or if the patient complains of pain as you advance the catheter, do not force it. Stop advancing the catheter and ask the patient to take slow, deep breaths and relax. Hold the catheter gently in place for a few seconds. The sphincter may relax, allowing the catheter to be advanced. If you're still unable to advance the catheter, your patient may have an enlarged prostate or some other urethral obstruction. Notify the healthcare provider. Once you've advanced the catheter, lower the penis, holding the catheter securely with your non-dominant hand, and allow the bladder to empty fully or partially according to agency policy. Slowly remove the catheter by pulling it straight out or by coiling it around your finger as you pull it out. Dispose of your used supplies. Provide the patient with hygiene care as needed, and help him into a comfortable position. Remove your gloves and perform hand hygiene. If a specimen has been ordered, label it in front of the patient. Bag the container and send it to the lab as soon as possible. Refer to the video skills for specimen collection. Measure and record the date and time as well as the urine output. Keep in mind the policy for post-catheterization voiding procedures.
Is it comfortable for you now?
Yes, ma'am.
Good. I just wanted to let you know that there's a hat in the restroom for you because we really want to monitor your output after the procedure. Do you have any other further questions for me now?
No, thank you.
Okay. Just hit the call button if you need anything at all, and I'll be more than happy to help you.
Thank you.
You're welcome.